Alright, the last part of my three-part video would be my medical supplies, my med kits. You notice that I had the FR1 pouch on the outside of the bag, which is my trauma pack. And then I also have my regular, everyday med kit that has all the other supplies. So we'll get into this one in just a minute. Okay, the FR1, first of all, on the outside, I have, start with the rubber band. I have a handy-dandy little flashlight. Very good to have. I prefer the head-mounted flashlight, which I keep in my other pouch in the bag, but this can get you going in a hurry here. Okay, then when you first open it up, you'll notice the bag is held by a string, so it won't flop out and let all your contacts fall out. Okay, you can loosen the string and open it up a little further. Okay, first thing you notice, I have a Ziploc baggie with four gloves, 2 pairs of what do they call them? Nitrite gloves. Anyways, they're the non-latex gloves. Okay, first thing you do, put those on. Then I have my blood absorbent materials. I have 1, 2, 3, 4, 5, 6, 7, 8, 9 of these 4x4 inch gauze pads. Then I have one large abdominal pad. It's a 8 inch by 10 inch, just like gauze. It's just a little thicker. Same thing here, another abdominal pad, 5 inch by 9 inch. I have trauma shears. Can cut through clothing pretty quickly. Then I have a roll of gauze, an ace bandage. Inside here, I have more rolled gauze. Let's see. This is, well, these are all pretty much all the same size. They're 4 inches by 75 inches. So lots of rolled gauze here, 1, 2. That's it in here. Then I have a syringe. This is just it's a very small syringe, but if I needed to rinse out a wound quickly, I could use this syringe. Then I have some blood stopper here. This is a Quick Clot Sport. This is a coagulant, I guess. Anyways, it works quite well from what I've been told. I've never had a chance to use it yet, fortunately. Then I have an Israeli pressure bandage. This is designed for very large bleed wounds. Good to have. Then I have over here I have non-stick dressings. These are 3 inches by 8 inches. 1, 2, 3 of them. And that is it for my trauma kit. So it'll get you going in a hurry if you're bleeding profusely, get in a car accident or whatever. This is the kit I would turn to. It's quick, easy access. I don't have to do anything, just unzip the sides. Boom, I have access to all this blood stopping stuff. Obviously, once I've stopped controlled bleeding, then I would turn to my standard medical kit for whatever other assistance I need, or obviously go to emergency room if emergency care is available. Got my trauma kit put back away. So let's get into my standard med kit here. You'll see there's a whole bunch of different compartments on this. In the front you have a see-through compartment. If I open it up, this is where I would keep my the things that I need to get access most often, basically Band-Aids. I have a specials Band-Aid. These are the large ones for some sort of knee injury or something, elbow, knee, something like that. I got about 5 of those in there. Then I have my other specials. I got fingertips and knuckle Band-Aids, 5 of each. Then I have my standard normal Band-Aids. I got about 15 of these. These are the fabric kinds, so they stretch and they stick quite well. Okay, then I have alcohol swab pads. Always great for disinfecting and also cleaning off an area so the Band-Aids will stick better. I've got about 20 of these, I believe, in here. Then I have antibiotic ointment. I've got about 8 packets of this. Good to have as well. And that's it for the front pouch, or for the front compartment. When you open it up the inside, I've got some things loose in the center pocket here. I've got 2 rolls of medical tape. This is the Trans4. I prefer this to anything else. It works quite well. You've used it quite a bit in the past. Then I have a variety of different sizes gauze pads, 4x4, 2x2, all kinds of different sizes in here. I probably have about 20 different gauze pads in here. Then once again, just like in the trauma kit, I have these abdominal pads, 2 different sizes, more blood-soaking material. Then over here I have a burn dressing. This is called a water gel burn dressing. I haven't used these yet, but from what I've been told, they work very, very well for pretty severe burns, so you never know when you'll need that. Then there's 2 more compartments. There's a compartment over here, which There we go. Very important to have. These are oral rehydration salts. When you're backpacking, you're sweating a lot. Water is great to have, obviously, but you also need to rehydrate your electrolytes. This is the electrolyte solution that will help you out. Then I have a roll of gauze. I'm sorry, this is a ace bandage, gauze, more gauze. Then I have my meds, I call it. Nothing special about it. I have aspirin, Advil, Tylenol, anti-diarrhea, and also I have some heartburn medication in here as well. Not a whole lot in here, but enough to last me a couple of weeks if I needed it. But the most important in here, in my opinion, is the anti-diarrhea medicine. Whenever you change your diet drastically, you're going to need something like that because chances are you'll have an upset stomach. Then I have my little burn kit, which has some non-stick dressings, burn gel, things of the likes. Important to have. Pepto-Bismol, just like I said with the anti-diarrhea medicine. You change your diet, you're going to have an upset stomach, so very important to have this. Along the same lines, Alka-Seltzers, same thing. I've got about 10 Alka-Seltzers in here, or 10 2-pack packets of Alka-Seltzers. I have a blister care kit here, which includes moleskin, second skin, alcohol prep pads, and a needle to burst your blister if you needed to. It's a nice little kit to have when you're walking a lot and you're not used to walking a lot. Needless to say, you will probably get some blisters or some very hot spots on your feet, and you want to maintain your feet as best as possible because without your feet, you're not going anywhere. Then I have more alcohol prep pads. I have a whole bunch in this one. There's probably about 20, 25 in here. And then lastly, for this side of the pack, I have a wound closure, which includes butterfly strips, steri strips, and also some suture. I don't necessarily think I'll ever be using this suture. You don't necessarily want to do this without professional medical training, but it is there nonetheless, just in case. But the butterfly closures and the steri strips would definitely be a great use if I had a big gaping injury. And then on the other side, I have one packet of emergency drinking water. I'm not keeping this as drinking water, I'm keeping this more as wound cleaning. I would just poke a couple of holes in this with a needle and squirt it onto the wound to clean out the wound, or I would use the syringe that I have in my trauma pack and just suck some water out and use that. This is sterile water, that's why I have this. It's very, very clean. Of course, I have one more roll of gauze. I have three different clamps here. You never know when you're going to need to clamp something off or help hold something. Very important, tick removal tool. I've got two of them. I did a lot of research and these seem to be the best on the market. I have a large one and a small one, and just instead of squeezing the tick's head with tweezers that might actually burst the tick's head, or inject more of the tick's saliva into your body, this actually just scoops up the tick. You spin it and it pulls the tick right out without crushing the tick and damaging it. Then I have a mirror if I ever needed to, if I had a face injury or a head injury. It's always nice to have a mirror to see what you're doing with your wound care. I have a little toolkit here. We've got three different kinds of tweezers, sharp ones, long ones. You never know, you get a sliver or whatever. There's multiple reasons to have a bunch of tweezers. Then I have another little Ziploc bag inside of this. It includes 3 razor blades, 3 X-Acto knife blades, and 7 different size sewing needles. You never know when you're going to need a sewing needle. Okay, and then of course, since I have those 3 X-Acto blades, I also have the handle for the X-Acto knife. And then I have a sterile surgical knife here, just a safety scalpel we call it, but this is sterile, so if I ever needed to cut something on my person, this would be the way to go. And that pretty much does it for my standard med kit.